The state is rolling out its latest solution to a big problem: hospital beds filling up quickly. We know some COVID-19 patients are no longer needing that intensive or critical care. That's where the old Gibson Hospital in southeast Albuquerque comes in. It's now ready to treat COVID patients once hospitals identify who should be transferred there. Joy Wang gives us a look.
We are in a state of emergency. Our local hospitals are stretched beyond their capacity. This site will provide support for the overflow. We'll be able to house the patients who are not quite ready to go home, but they don't need acute services in a hospital.
Hospitals will decide which COVID-19 patients will come to this facility, depending on how they're doing.
The patient may still need oxygen, but they're stable enough to come here, but not stable enough to go home.
2 floors will be able to provide continuous oxygen.
We've seen some immediate, very tragic results from people who waited too long, who didn't assess their breathing issues before asking for medical assistance. And we're going to go slow, right? So we've identified staffing using a variety of sources.
The Department of Workforce Solutions has called over 400 people who are listed in unemployment records as healthcare workers. They've recruited 55 individuals so far, mainly nurses and certified nurse assistants, which are exactly the priority for the recruiting.
Another 2 floors can be a safe space for people quarantining, like a healthcare worker who's been exposed and can't go home.
There is absolutely a need for this facility. As patients come through the emergency department into the hospital who are very sick, we need to have beds available for them. So the patients who are not as sick move here and we free up those beds.
A reminder, this isn't a place where you can randomly show up if you need medical assistance. It's specifically for people who have been referred. Maximum capacity is 180 beds. Joy Wang, KOB4.